Hello everyone, and we are very excited to be with Dr. Arjit, rank 64 in the INI CT 2021. Amazing rank. And I think this is the, infectious batch. All our students at Foundation batch Jaipur are bringing the amazing rank. So, like always, Jaipur and DBMCI rocks. Yes, and as you know, someone was saying कि मैम हमें बाहर से motivation चाहिए ही नहीं. Our seniors at DBMCI are there to motivate us because every time they are bringing amazing results. So heartiest congratulations, Arjit.
Thank you so much, ma'am.
Can you brief how your journey started? I think you must be motivated from your seniors at DBMCI, and
Yes, ma'am.
how you actually started the journey, and what was that different thing that brought you to this result?
Ma'am, it started in Jan 2020, I guess, along with my internship. So I was doing the regular batch from 2018 only. So I've
Mhm.
prepared or attended all the live classes in Jaipur, and I made that notes before the starting of my internship. But I didn't read them well before the internship. So internship was my plan. So I started, and the paper got delayed, obviously, and it was very, disheartening. Twice the paper got delayed, and the
Mhm.
all the momentum that we had, just it all went down the drain. But yeah, we tried. So the finally the exam, and I had the attended the vibe session also in the final year, and all the subjects are done. And I was following a subject-wise test series just to keep a track on my progress. The subject-wise test series was very helpful, to get a subject done in a particular allotted time period. But
Mhm.
everything didn't go well for me as the exams are concerned. But ultimately, I have this the NEET before the NEET exam. I had the flu, so I was consistently getting good ranks in the GT. But yeah, the NEET day was not my day. So I got a decent rank of 3,400 something in
Mhm.
NEET exam. But I knew from the beginning that this is not the rank I've worked for. And
Mhm.
in the previous INSCT also, I got a rank of 800. So I talked to Rajat sir that because I was getting some branches like psychiatry and something. So I talked to sir that I always wanted to take ortho, and I'll definitely be taking ortho right now. But
Mhm.
I talked to sir that should I consider other branches because I don't know about the need, and everything was uncertain. But Rajat sir told me that you deserve a better rank, so just wait for it, you'll get it ultimately. And I was
Mhm.
hoping really nice for NEET, but it didn't go well. But this exam, I honestly didn't prepare much for this exam. I did study a little, but I was not entirely focused because in the NEET also I was getting also at some periphery, not at SMS at least, but at some peripheral colleges. So I was okay that I'll get ortho, but the luck turned my way, and this was my day. So
Yes. So if you keep on working hard, I think God will
yeah,
always answer the
yeah,
hard work. Yes.
yeah.
So maybe
The
one day
the
may not be the fortunate one for
Yes,
everyone, but your day will definitely come someday.
yes. The endurance has to be there. You have to believe, keep believing. Just you don't have to give up. I didn't give up at any point. There was some lows. Obviously, everybody has lows. So but they have to keep your track of the time you're allotting to the subjects. That is very important.
Mhm.
Don't waste too much time on one subject. Like people end up doing surgery for 15 days. That's not, very the right way of doing it. Just have to allot a particular crunch time to a particular subject so that you don't waste much time on a subject. Like if you have allotted if some part of the subject is left, it's okay. Like if you have done 85% of the subject, that's also okay. But giving too much time, and especially the next batch coming up, they have the exam in 4 months only.
Mhm.
So I know many people who have just started, so they are very scared that how will they do it. But they have to
Yes.
keep the time. A major factor is the time for us wasn't the major factor because everybody had a huge amount of time, so everybody read everything. So that was a different story. But this exam they are targeting is a very time crunch exam, because there are very few months and the exam has been practically preponed. Everybody was guessing around May and April, so they have to be on time. Every subject has to be given a short amount of time, and if the subject is incomplete a little, you cannot complete subject completely. It is impossible to complete a subject.
Mm,
So
mm.
if you do good enough with 80% also, that is okay. But have to give GTs and have to practice MCQs. That is the key, I guess.
Right. So, how was your experience with Vibe? Any subject that you liked the most?
Ma'am, Vibe was a very, very helpful session, especially in some image-based subject like ophthalmology was very good by you, and patho was very nice, ortho was very nice, and Dharma was good. Anesthesia was amazing. So these subjects which are asked image based questions are asked. Ophthalmology in this INI-CT was also image was asked of the step of the surgery was asked. So ophthalmology is definitely a very very image based subject. And the
Yes.
washes ring was asked. Many images
I
came
think
and
Voshius ring to direct classroom notes
yes, yes, that
say.
that was from the Vibe session. We had the
Yeah,
same image in the Vibe booklet also.
yeah, yeah.
And every year I have seen the Vibe of my juniors also. It was a little on the next level. So Vibe,
Yes.
I definitely would recommend to everybody. Matlab, if you are a student of DBMC, if you're not, it doesn't matter. Matlab, Vibe, you have to do it. It is amazing. So the thing is, you get a booklet and you have all the images, important images at one place. You don't have to, cramp images from here and there. You just have them at one place. You can add some images, but more or less, it's the important images are there in the white booklet. So it's very amazing. And some subjects was really really good.
Okay. Um, what did you do in the last week of the INICT? That's a crucial time when
Yes.
we are in dilemma that we have read so much, we have done so much many things. So what you should consolidate in the last week?
Yes, ma'am, what I thought was what mistake I did in NEET was I was very anxious and I was,
Mm-hmm.
throwing my hand in the air and not working on a specific target or a
Okay.
goal-oriented study wasn't there. I
Mm-hmm.
what I think I lacked was MCQ practice and previous year questions, which I knew I've done them earlier, but I didn't, see them just before the exam, which is very helpful. So
Mm-hmm.
what thing which I changed in this exam is I was very thorough with the last year, previous year questions, 2 3 year questions. In the last week, I did that only, and I just saw the previous year questions and read the topics which has been asked, and it is very very matlab predictable pattern in INI because they are very focused on the topics. Like in the last INI also there was questions on anti-thrombotic drugs. This time also they asked about anti-thrombotic drugs. They are fixed. They are more or like less asking the same topics but just twisting them, and there is a fixed question of stroke. Every paper
Yeah,
has
I
an
think
MI
AIMS
question.
people are known for doing this. There are
Yes, yes,
certain
yes,
set of topics they are keep on
yes.
repeating,
They
asking.
just love instruments. They love
Mm,
emergencies. They will
mm.
ask emergencies. They can't give you a paper without emergency. They
Yeah,
can't give you a
yeah.
paper without the instruments. Every exam has 2 to 3 instruments in it, and I think it's easy if you go through the previous year questions. But
Mhm.
the people starting right now should not start by those previous year questions. It is the thing which a person who has done a first reading, second reading, then I would suggest that previous year questions are a good thing to go. In the revision process, it is a very beneficial thing. But if from the beginning, if you have time, just read the subject, read the notes, and in when you're in the revision process just before the exam, the previous year questions are gold. They are literally gold, and because they and recently that I have noted is INI is repeating questions. Matlab, they're repeating topics. That's true, but I've
Mhm.
seen some questions which have been repeated in the last
Mhm.
INI-CT also and this INI-CT also. At least there was I guess 3 to 4 questions which was directly from the previous year. Matlab, they were same questions. I have them in the Q&A,
Mhm.
and that is a very crucial thing. So if you get 4 questions in IN, that is gold.
All right. So, what would you say if I ask you in nutshell, if anybody wants to prepare from the edge? So, can I say that the notes along with the test series and vibe is one complete solution to go with.
Absolutely, absolutely. I have no doubt about it. The things which have been going on in the preparation phase is like people are doing too much. Matlab, you have to keep it simple. Matlab, when it gets too complicated, it is hard to manage. Just
Hmm.
keep it simple. Just whichever source you're following, it doesn't matter. Actually, the source of notes doesn't matter, but keeping one source is important. Some
Hmm.
quality does matter. That like vibe is a different thing. Matlab, you can't get it everywhere. Matlab, no other platforms are giving the sessions like vibe. Vibe is absolutely must. I feel that's my opinion. But keeping the notes simple, just not adding too much stuff into it. You have to add previous year questions definitely, but not adding too much stuff. Every Q bank, every question you don't have to add. I guess you just keeping it simple will let you through this exam. And you just have to have two things. One is confidence. Confidence. You will need to have confidence upon yourself that you will get it. You'll get it in the first exam or the second. You will get it. You will get it. You have to be confident. And another thing, you have to be optimistic that everything will go in the right direction. So far, it has gone in the right direction, so it will go in the right direction. So it will. You have to be optimistic and you have to be confident. You have to just let it be pseudo confidence. Be it be pseudo confidence, but you have to give yourself confidence and
Yeah.
have to track your GTs. GT scores are important. Just keep
Mhm.
improving 5 questions every GT, 2 questions every GT,
Mhm.
and maintaining your score would definitely get you through. You have to control your anxiety. Just have to be at peace, and be confident about your preparation.
Right. So you have to be fool your mind every single time that
Yes,
you are good and you are going to do it. And just sticking to the notes, please trust your notes. If you
definitely.
are with us, you are in safe hands. And if you do the multiple revision of these notes along with the strongly documented vibe session, as Arjit said, because nowadays more and more image based questions are being asked, and though all the images are being shown in the class notes also, but I think that is giving you a mini revision kind of a thing where you can revise whole lot of 19 subjects in just precise hours, and that is the need of the hour just before going to the examination. So, and above all, your positive
Mhm.
attitude and mindset is very, very important. Perfect example and perfect piece of advice. A wonderful score, Arjit, and a wonderful advice by you. Heartiest congratulations once again from whole of the team DBMCI. And we wish you all the very best and all the good luck for your future endeavors.
Thank you. Thank you so much.
Thank you. God